If you're a lady and you are in your 40s, please listen. Here are just three wellness checks that you must not skip, at least yearly. That means that you can do this every 3 months, every 6 months, but you must not skip doing these wellness checks for your health at least once yearly. Now, I know that most of you say, oh, Dr. Nonny, why women in their 40s? It's simple. Now, this is a beautiful decade of life. Don't get it twisted. Most of us would be very independent. We are excelling in our careers. We have completed our family size. However, most women do not also realize that when you're getting to this age, that's when you have to also be more proactive with regards to your health. If I see a young girl in her 20s coming to me with breast lump, ovarian cysts, I probably would just reassure her and follow her up. Probably in the next 3 or 4 months, most of the times this would likely regress. Example, a woman who has ovarian cysts. Right. But if I see a lady in her 40s with the same condition, I would take more steps in investigating because of the risk of having some sinister changes. So this is also the age bracket when it comes to you viewing in the health point of view that most diseases would likely accelerate. And most of these tests, you don't have to do that in the hospital. You can do that from the comfort of your home. So number 1, your blood pressure check. There is a change in the composition of the arteries, which is a part of your cardiovascular system, and the arteries tend to be less elastic. In your 20s, 30s, it's so elastic, so flexible, blood can flow through it so freely. When you're aging, it begins to get more stiffened, and when the blood is flowing through your arteries, there is more resistance and there is increased blood pressure, and so you see why you have to be proactive. When we are also increasing in age, if you're following my menopause Monday post, you get to find out that I've said severally that this is the perimenopausal age range when our female hormones begins to decline. Our female hormones, the estrogens, protects our hearts, protects the blood vessels. So we begin to lose the protection gradually. This also compounds to what I just talked about with regards to the blood pressure. So please know your numbers. Because when we see most women, they come into the hospital in their mid-40s and you check their blood pressure, 170 over 100. What? And some of them would not even have headache. They're already having problems even with their kidneys. But if you detect this earlier, the more options you have, the less chances that you may likely even have to take drugs. So with just lifestyle, reduce salt intake, exercise, your blood pressure would likely revert back to its normal level. Number 2 is your blood sugar check. So simple to also do at home. When women tend to increase in age, we tend to have higher chance of having type 2 diabetes. And one thing about this disease condition is that they can also affect your end organs, like your eyes, your heart, your nerves, your kidneys. Yeah. So be proactive, know your blood sugar numbers. Number 3 is something so simple that you can also do even while lying on the bed. Your breast self-examination. We all know that breast cancer is one of the female cancers that kills women worldwide as they age. And so a simple self-breast examination, the boobs are outside looking at you. So just get your mirror 5 to 7 days after your menstrual period, or if you're menopausal, check this every particular date in a particular month so that you can be able to monitor the changes. Use your mirror, look at your boobs. If there are any changes, take note of that. And lie down, just use your hand and feel your boobs in a circular motion to see if you can feel any small masses or abnormal growths in your boobs. Also express your nipples to also see if there is any abnormal discharge. And at the same vein, use your hand to feel around your armpits. And that's all. So know your figures, know your numbers, and act early.